Yes, sir. Thank you very much. So every time I'm here with Suhas sir, whenever I am in a course or otherwise also, I have to say this, and I loud and clear. Suhas many years ago, and I am totally indebted to him for all the advancements could have made during this time. Thank you very much. So we will Femto victories in difficult cataract. It is not possible to show all the Femto victories, but I will take you through one or two important situations and then a very special situation which I want to let you know. And this is a pupil that is, of course, mid-dilated pupil that you can see. And the opening is sometimes a little difficult, and especially the side port opening. And I specifically wanted to show you this, that if in the proper technique, you see the spatula going in quite well, however, it is not always very rosy. The other thing that I wish to show in this is the importance of staining the anterior capsule, though the capsular excess has already been made, but still you need to stain it. And then for the harder cataracts, again, I selected this particular video to show you that hard cataracts do require special settings. If your settings are not too good, then you will not be able to do clean, so that the cleavage is not all that regular. It should have been better, more energy should have been used, and thereby this hard cataract, though it's becoming easier than what would have been in a direct shop, in such cases, it is easier definitely with the Femto, but here I would like to say that it is to be made with proper settings. And as you can see, it's quite a hard cataract, and there is hydration of the ports already occurring before gone into the full nucleus disassembly. And you can see quite hard how hard the elastics as you go ahead. So these steps are important, though it's just not important to have a good Femto laser platform, but it's also important to have the applications people help you to redefine as well as fine-tune the settings on the platform. So I began with this specific video just to show you that if it is not in optimal setting, then all is not well, even if you have a good Femto laser platform. So this is the nucleus disassembly, and we will go on to the next small video. And this is again a video of a subluxated cataract. Now, this is again a very special situation in which a subluxated cataract subluxated anteriorly, and the anterior space is so small. It is quite shallow, the anterior chamber, and we have to improve upon the settings. So we have improved upon the settings, and this time we are a little careful. And you could see that when I took the side port incision in, it touched the anterior part of the capsule. So you understand that it is so shallow. So we have to be very careful in this situation, and I on purpose did not do the side port as well as the main port, and we did a very gentle hydrodissection. But what is important in this case is look at the way that we could do a hydrodissection in this one. And the most toughest part of any subluxated cataract is what? It is the capsular excess, because as the subluxation, the zonule laxity is an issue, and you do not have the force and the counter force acting upon. Therefore, the most important part or the most difficult part of a subluxated cataract is the capsular excess at times. So this capsular excess otherwise has been well made because of the provision of the femtosecond laser, and then the removal of the nuclei are not so difficult. And you can see in this case, there's been a nice cleavage and everything is quite good. This is just about a grade 2 cataract, nothing much. This could have been done otherwise had it not been for the subluxation by just phacoemulsification. But what importance or improvement in the technique the femto laser gives is the capsular access. And then with a good and stable chamber, I'm able to put in the CTR quite well. So once the CTR is in place, the next things become quite easy, and it's a stable bag. We are working in stable environment, and then all these pieces can come around, and the next part is not so difficult. So I will not dwell upon the next part, and I will go to maybe the next video. Now, this is a very, very particular video, and I have placed this on purpose, just to give a little bit of a twist to this session. So this was a nightmare in phaco surgery, and we made it into a film, and it is one of the worst nightmares of my life in any surgery, not femto, but any surgery. I think this is the only time I had such a complication, and it is truth and it is real. So I had it in Amar's OPL also at one point of time. And so this is the video that I'm going to share with you now. This has important aspect, and we do not have any financial interest at all to disclose. So this was a patient which just came up with 636 vision and clear cornea and grade 3 cataract, and we went on to do the femto laser and technique, and this is the plan that we did, and the femto laser was done. So all this went on very well. So no issues here, and we opened up the incision and took out the rexus. So you can see it's just about a grade 2, grade 3 cataract, nothing major. But the patient was a very apprehensive patient, very, very apprehensive. It took him nearly months to decide upon the cataract. He made sure that I was a surgeon who could handle his cataract. He made sure that we had good equipment. He made sure that we had the right femto laser machine and also the phaco machine. Obviously, he made sure that we were using the right lens. And for all such patients, what happens? For all such patients, complications happen. Yes, I'll just take one more minute. So we had, in this case, a rexus run out. The rexus run out. God only knows how I had it. But it was there. So thankfully, it was not a very large one, and it did not extend too long. And this of is what you need to see. And so we put in the lens. You can see there's a little bit of cortical matter, which I'll take out after I've placed the lens in. And the lens I've placed in perpendicular to the haptics, and all was going well. But then as I close this, and you're going to see something that possibly you've never seen before, or I hope you never see before. And at this point of time, patient was very, very sick. And look at this. This is vomitus in the eye. The patient coughed and vomited and turned, and the whole vomitus came into the eye. It is truth. And then we had, this is, of course, the role play that we did for this patient. But I'll go on to the next part, and we advised him the regular, and I was absolutely scared. But remember, we had actually closed the incisions with tightness, and this was what he presented next day. And whole night, none of our whole team members could sleep, but this is what we came up with the literature. Femtosecond laser versus the manual clear corneal incision cataract surgery, and did show that the tightness of the wound is very important. We had cleaned the whole area. We put in every 15 minutes, this patient got antibiotics both for the gram-positive and the gram-negatives, and we asked ourselves, did flax save the day? Because surgery was not complete, the ports fully not hydrated, and the vomitus was there in the cul-de-sac. So yet no infection, and God willing, that of course. So thank you very much. Femto is a reality, and it's really ready for prime time. Thank you, sir.
Thank you so much, Partha.